minutes. I think we're probably ready to go. We are recording this, right? We are recording this. All right, let's get started. We will have Dr. Harris start. Here's the agenda. Welcome to World Elder Abuse Awareness Day. And our agenda, we will share our proclamation. We'll have opening remarks. I'll do an introduction with Bill Benson. He will present, and then we'll do our closing remarks. So thank you all for joining us.
Would you like me to go ahead?
Yes, please do so, Dr. Harris.
Thank you kindly. I don't know why I deserve this honor, but thank you. My name is Michael Harris. I'm the Interim Provost and Vice President for Academic Affairs at Tennessee State University. Prior to that, I served as 7 years as Dean of the College of Public Service, where our CARES Institute is housed, and prior to that, I've done other things. So that's the introduction about myself. I want to welcome personally each and every one of you to this event, as we have done in the many, many years before. Started before me, and we continue to do this. I believe, I hope that next year we will do it again in person, and we will be able to interact. But I'm certainly so pleased, thankful for all of those who are attending and all of those who worked so hard to make this possible on this June 15, which is, of course, once again, we are not celebrating. There is not much to celebrate, but there is a lot to acknowledge in this World Elder Abuse Awareness Day. And I would like to begin, before I give my 45-minute presentation like any academic, just kidding, by acknowledging some of our guests. I want to acknowledge Commissioner Kearns H. Carter, who I haven't had the privilege to meet yet personally. I'm looking forward to. I've always worked closely with the commissioners and appreciate the work the state's doing, and I'm looking forward to meet the commissioner. I want to thank the planning committee, as every year that I do. This is the 8th year, for really outstanding work. This is a partnership between the CARES Institute and Tennessee State University with the state. We are so thankful, appreciative for the state. And all these years, I've met amazing people in the state. And of course, the most amazing are those that are out there in the field and work and come to this event. So again, I can't thank them enough for coming. I want to acknowledge my colleague, Dr. Carol Robinson, who's couldn't be here with us today. I want to acknowledge Joyce Reed for being here today. I want to acknowledge Renee. I always struggle, but we'll give it a try again. Butchilon, and that's the best that I can do, or Butchilon. And I'm just Renee. I'm trying. I really am. I want to acknowledge Patty Toasty, who'll be talking later. I've worked on this one a little bit, so I think I'll be okay. I want to thank Amy Vian and thank her. Lauren Palladino, I want to thank her. and of course acknowledge our speaker, which we're looking forward to hear the presentation, William Benson, the NAPSA policy director. And if I missed anyone, then my profound and embarrassing apologies. And if I didn't, then that's just what's expected. So I want to begin with the acknowledgement and thank you. And I do want to say just very, very few years. As the years go by, and as I said, I am fortunate or now more troubled in participating in this day, the 8th year. I do also want to acknowledge that CARES at Tennessee State University does a lot of a variety of things. This isn't a place to talk about it, but I do want to acknowledge that Representative Love Senior had the vision of allowing us the funding to continue the work we do year-round on this, and certainly the highlight is working with the state. I do want to say, and we know the data, we know the statistics, I'm sure the speaker will talk about it, the billions that are stolen, the 1 out of 14 that we only really know about. I would like to say that these events are more important every year, and what we do year round is more important. I don't want to sound pessimistic because I'm full of energy to do more, but what I want to say is that never before have I seen the need to do more. Not because of COVID and what took place in COVID, and we can talk about nursing homes and so on, and I'm not going to get into any politics. I'm always stay apolitical in my position. But what I do want to say is that a long time ago when I was growing up, I guess that maybe people like to say that might give away my age. Well, that's okay. There was a song by Cliff Richard that said that the world belongs to the young ones. And I think never ever before is this more true when all the emphasis is on the millennials, and if they got their, one of my son is a millennial, if they got their right toast and avocado, and if they had the hot chocolate to the right temperature, which is really important, and I also care about it. But I feel that we in the United States and the world, and I'm speaking as someone whose academic expertise or public policy are not or unable to, for some reason, despite our efforts, put the issue of world elder abuse awareness on the agenda strong enough despite our efforts. We have these symposiums, we do other activities. I am concerned that as the world is moving on and more of our population is becoming defined as elder, and more challenges face us, and those in the field are so aware of it, way more than I'll ever be, as much as I talk and hear and listen and go out. My concern increases every year. And I'm not going to sit here and say, oh, we did this and we did this and we did this and we did this, which maybe I did 8 years ago. But now I think it's time for a movement made me in the United States. And I'm not talking only about the world, which this is a world day. And this is something that certainly we can and we should all unite around it. And maybe from this joint effort with Tennessee and the state of Tennessee, we can begin a national movement. This is something we all can join around. This is something that all our values, our integrity, what we believe in, we all share. So how come that it's not a major issue on our policy agenda? And there are limited things that can come on policy agenda. So we will all talk again without politics about infrastructure or about I don't know what. But I have not heard anywhere across the map people passionately, factually, resource-wise, speaking about what are we facing and what are we going to do to to address this challenge. So on that note, which is really more of a call for forcing this agenda on the state and on the nation, I express profound and deep gratitude to all of you who, of course, you are the wrong people to ask this question because that's what you do. And unfortunately, we always ask the wrong people the question because they are the ones in the tent, in the room, and all the others are not. So sometimes the question is idiotic and just a rhetoric question, but I just wanted to ask it. So on behalf of Tennessee State University, in profound gratitude to the state and all those that are out there daily in the field, I am closing my lengthy and boring welcome.
Thank you, Dr. Harris. Thank you. We always appreciate you and Dr. Kara and our partnership with this CARES conference every year, and certainly looking forward to an in-person event next year. So thank you again. All right, so welcome everyone to our World Elder Abuse Awareness Day event, virtual event, the CARES conference this year. We are planning, I believe, to have a series, so we'll have more information about that later on. I just want to remind everyone that you cannot unmute yourself, but if you do have a question, we will have a Q&A answer. Please feel free to raise your hand, and we will coordinate with you to get your questions answered. And without further delay, I'll go ahead and turn it over to Joyce Reed to read our 2021 World Elder Abuse Awareness Day proclamation.
Thank you. I'm going to put my glasses on, so hopefully I don't stumble too much over these whereases. So the proclamation reads, State of Tennessee proclamation by the governor. Whereas older Tennesseans are valued members of society who deserve to live safely with dignity and as independently as possible with the supports they need. And whereas elder abuse is any act that harms an older person or jeopardizes his or her health or welfare and is a tragedy inflicted on vulnerable older Tennesseans and is an ever-increasing problem that crosses all socioeconomic boundaries. And whereas the Adult Protective Services Program of the Tennessee Department of Human Services and the Tennessee Commission on Aging and Disability are responsible for awareness, prevention, investigation, and reporting of elder abuse, neglect, and exploitation, and do hereby declare prevention and deterrence of elder abuse, neglect, and exploitation a priority in Tennessee. And whereas the Tennessee Association of Area Agencies on Aging and Disability, TN4AD, and the statewide Tennessee Vulnerable Adult Coalition and the regional coalitions in Middle, South Central, East, Upper Cumberland, West, and Northeast Tennessee are grassroots organizations working to educate older Tennesseans about prevention strategies to identify suspicious activities, to raise awareness, and to encourage reporting of elder abuse, neglect, and exploitation, assist with the safety, healing, and recovery from abuse. And whereas the State Coordinated Community Response Team, comprised of approximately 20 state agencies and organizations, collaborates to improve the investigation, response, and delivery of services to older and vulnerable adults through a focus on innovative and efficient intervention models to protect Tennesseans. And whereas the Tennessee Department of Commerce and Insurance and its Insurance, Securities, and Regulatory Boards divisions and the Tennessee Attorney General's Office Division of Consumer Affairs raise awareness about preventing financial scams, identity theft, and fraud across Tennessee by holding public outreach events and creating educational materials in order to assist the elderly and their caregivers. And whereas Tennessee District Attorneys spearheaded the drafting, enactment, and implementation of a series of public acts to more clearly define and more effectively deter neglect, abuse, financial exploitation, and harm to our elder population. And whereas the Tennessee Department of Mental Health and Substance Abuse Services, Tennessee Bureau of Investigation, Tennessee Department of Health, Tennessee Department of Financial Institutions, Tennessee Office of Criminal Justice Programs, Tennessee District Attorneys General Conference, Tennessee Supreme Court Administrative Office of the Courts, and other state organizations and leaders work in support of efforts to prevent elder abuse for the well-being of older Tennesseans. And whereas the Tennessee Department of Intellectual and Developmental Disabilities is a state's protection and advocacy organization serving to protect the rights of Tennesseans with disabilities, including elders, through monitoring of events, conflict resolution, and investigating allegations of abuse, neglect, and exploitation where people live and or receive services, and working to resolve instances of abuse and neglect through legal advocacy interventions, placement on the statewide abuse registry, systemic change by improving policies and practices. And whereas Disability Rights Tennessee is the state's protection and advocacy organization serving to protect the rights of Tennesseans with disabilities, including elders, through monitoring and investigating allegations of abuse and neglect where people live and or receive services, and working to resolve instances of abuse and neglect through legal advocacy interventions, including improved policies and practices. And whereas nationally and in Tennessee, elder abuse is greatly underreported, and there is a significant need to increase education and awareness of this crime against our valued citizens. And whereas all Tennesseans have a responsibility to serve as protectors of the older population, educating ourselves on how to empower and assist them, serve as a resource, and be attentive to supports and services. Now, therefore, I, Bill Lee, Governor of the State of Tennessee, do hereby proclaim June 15, 2021 as Elder Abuse Awareness Day in Tennessee and encourage all citizens to join me in this worthy observance. And with all that said, I'm going to turn this back over to Patty.
Thank you so much for sharing all that. We will make sure you all have a copy of the proclamation, and thank you so much for those introductions. We will now begin our next part where I have the very distinct honor of introducing a very dear colleague and all-around great guy, Bill Benson. I'm going to read to you his biography because it is quite impressive, and then I'm going to share my personal thoughts about Bill, since I've known him for about 6 or 7 years. Bill Benson is the president of Health Benefits ABCs, offering health and aging policy, educational and strategic planning consulting services. He has a long association with efforts to combat elder abuse, healthcare fraud, and protecting the rights of older adults. Since 1998, Benson has served as the National Policy Advisor to the National Adult Protective Services Association, representing state and local APS programs. He played a key role on behalf of NAPSA in drafting and enacting the Elder Justice Act and securing the first ever federal funding for state APS program in 2021, which he'll share much more about in the presentation. From 2006 to 2018, Benson worked with AOA's National Resource Center for the state's senior Medicare program, providing technical assistance to SMPs in their effort to educate beneficiaries about fraud and abuse in the Medicare and Medicaid programs. As a former acting Assistant Secretary for Aging at the U.S. Administration on Aging, he led AOA's role in Operation Restore Trust, the U.S. government's national anti-Medicare and Medicaid fraud initiative, the establishment of the SMP program, and managed the Elder Rights Program, among many other responsibilities. Benson spent 8 years on Capitol Hill in senior roles and was heavily involved in the nursing home reform provisions of 1987 and the 1987 and 1992 reauthorizations of the Older Americans Act, including the creation of the Elder Rights title of the Act. As a result of Bill Benson's leadership while co-chair of the American Society on Aging's Public Policy Committee, ASA adopted in 2018 elder abuse as one of its top 2 policy priorities. This is like super exciting. Benson co-founded and is president of the American Association for International Aging, which focuses on American Indian and Alaska Native elders. IA2 recently completed a federally funded project about healthcare providers' experience in identifying elder abuse among American Indian and Alaska Native patients. He is a former California State Long-Term Care Ombudsman and is a past president of the National Citizens Coalition for Nursing Home Reform, which is now Consumer Voice. Since 2000, Benson has hosted First Person, a series of conversations with survivors of the Holocaust before a live audience at the United States Holocaust Memorial Museum. I really wanted to share and read to you the full array. I tried summarizing his biography, but it was so challenging because there's so much information and so much that Bill has done. But now that you know what Bill is passionate about and is accomplishing, I want to tell you what stands out for me about Bill. What stands out for me is his ability to connect with others, ask questions, his sense of humor, and his jovial personality. Bill's always asking people their opinion about what can be done to better protect older and vulnerable adults. With all of his experience and years of service, he wants to hear what other people have to say. He listens. He goes out of his way to help others. He's accommodating and flexible. Not only does Bill have invaluable experience and expertise, he also has a great spirit and a love for baseball, particularly the Boston Red Sox. Thanks, Bill. We appreciate you joining us. That might have been a little bit of a fib. I'm sure you'll come back with it. The Red Sox are my favorite. Appreciate your time today to talk on World Elder Abuse Awareness Day and to share the evolution of APS.
Patty, thank you for that incredibly gracious introduction, with the exception of the very end. I'm just grateful that you did not say I am also a huge fan of the Patriots, being a Baltimore Ravens fan, that's for sure. Patty, that was over the top. Thank you. It's incumbent upon me now to go back and whittle down that introduction, but thank you for your personal addition at the end. I want to say thank you to Renee, to Joyce, to Amy, to Lauren, and to Patty for all the work that you've done to create today's event, your World Elder Abuse Awareness Day event. Dr. Harris, thank you for your remarks. I really appreciated them. So you know we're sort of kindred spirits. You and I may be among the few here today who remember Cliff Richards. So I certainly appreciated that. You know, this is easy for me to do. All I have to do is be given a link and get on and offer some thoughts. But I recognize the immense amount of work that goes behind the scenes to make a 1 hour event like this work virtually as well as in person when you're able to do that. And so I just want to give my nod to everybody who made this possible at the Tennessee Department of Human Services, at Tennessee State University, as well as the CARES folks. So thank you. Made it easy for me to just get on and offer a few thoughts today, which I'm very much looking forward to do. And so I'm going to launch into that now, if I could do that. I'm just so you know, I'm in Maryland. That's where I live. I'm in a little remote, sort of rural little pocket, just about 25 miles from Baltimore and 40 miles from Washington, D.C. And fortunately, you can't hear the swarms of cicadas that are outside. Windows are pretty good, so you can't hear that. So if I could advance the next slide. I'd like to share just a little bit about the National Adult Protective Services Association, the organization for whom, as Patty noted, I have served as the National Policy Advisor for a lot of years, since 1998. So that's what, 23 years and counting. And we've not had a more exciting year than 2021, as Patty said, with our very first ever federal funding dedicated to states for adult protective services. And I will certainly come back to that very, very soon. But NAPSA has been around for several decades. In fact, one of the early founders of NAPSA was a former APS administrator from Tennessee. NAPSA engages in advocacy. That's sort of what my job with my colleague, Kendra Keene. You see the two of us pictured here. We do the national policy work for NAPSA in the metropolitan Washington, D.C. area. Beyond that, NAPSA is just dedicated to supporting APS administrators and staff, investigators, line staff, and supporters and friends across this country. NAPSA is also home to the National Institute for Elder Financial Exploitation, NIFI. And NIFI does a couple of things annually. One is to host NAPSA's World Elder Abuse Awareness Day event, which we held yesterday. Usually, like your event, it's usually in person. Our event is usually at the Securities and Exchange Commission in Washington, D.C., but today, like last year, was virtual. We had a great kickoff, and I was glad it was on the 14th rather than actual World Elder Abuse Awareness Day like you're doing, so that I could join you. I might also, just as an aside, say that The trade-off for my agreeing to do this today was to extort an invitation to come back if I do a good job, so that I can join you in person, which I would really like to do. And the other thing NAPSA does that I want to mention is host the nation's only elder abuse conference that's truly national in scope, not only dedicated to elder abuse and vulnerable adult abuse, but specifically as well to adult protective services. We are returning to an in-person conference this year in November in San Diego. So we just hope there's some of you that might want to get out so badly that you're willing to come to the NAPSA conference in San Diego. Next slide. Just a little bit about adult protective services. You know Tennessee's adult protective service programs, but there's tremendous variation across the country. 64% of states' APS programs are like Tennessee's. That is, they are state administered. They're run by the state, and most of the workforce are state employees. About 15% of the programs are county-based or county administered. Ohio, Illinois, California are examples of programs, states where APS really is run at the county level. And of those, 21% are administered in, or 21% are administered in various other ways, including through not-for-profit organizations like area agencies on aging. Just slightly more than half of the state's APS programs are administered by state departments of human services like Tennessee, or departments of social services or children and family. And the other remaining programs across the country are administered by state units on aging or state departments of aging. APS serves as a victim-focused social service response to elder and vulnerable adult abuse, neglect, and exploitation. And APS works closely, collaboratively with law enforcement, other parts of the criminal justice system, the Aging Services Network, healthcare providers and systems, and many others. Next slide. There is, as I mentioned, great variation across the country with respect to APS, not only as to where it's located and how it's administered, but there's no common definition of who is served in each state or what services they receive. Tremendous variation. There's variation in with respect to where victims live and to the extent to which APS can respond. APS does investigate in community settings reports of abuse, neglect, and exploitation in every state. With respect to nursing facilities or nursing homes, APS has jurisdiction in about 50% of the states, and I probably won't get to that topic today, but it's one that I think is an important topic. And I believe that APS has jurisdiction in assisted living in every state as well. With respect to eligibility, 42 states provide eligibility provided there's a report of abuse, neglect, or exploitation for all adults with disabilities age 18 and over. In some states, it's limited to those age 60 and over only, or to those 60 and over who meet a state definition of vulnerable. So there is variation in that regard. Next slide. Elder abuse, and I'm not going to spend much time here talking about elder abuse itself, because I'm going to stay focused on sort of the policy side of things. And I think probably most of you are familiar with it, particularly those of you who are part of your coalitions as well as adult protective services. But what we know from all the research, the unmistakable findings that we have, elder abuse is very common. It's highly underreported. It's very lethal. Abuse kills. And it's very expensive, not only to victims, but to taxpayers as well. For example, to Medicaid programs that have to pick up the healthcare costs associated with those recovering from abuse. Next slide. We know that elder abuse is terribly underreported. And from the most comprehensive prevalence study that we've had so far, led by Dr. Lax and his colleagues in New York, we know that for every one case of elder abuse that comes to the attention of a responsible entity, typically adult protective services, law enforcement, and others, that there are 23 that never see the light of day. So truly the iceberg metaphor really applies here. And we know that the disparity between reports and actual cases or incidents with respect to financial exploitation is even greater. I think it's 1 in 40. So we have a lot of work to do to not only respond to the cases that come to light, but to begin to uncover those that remain secret and behind closed doors. Next slide, please. So now I'd like to turn to, what has been the national policy response to elder abuse, a bit of a history lesson, and then bring us up to the present and a few thoughts looking ahead. Next slide. There's a lengthy federal history with respect to elder abuse, not a lot of accomplishment, I must say, but a lot of attention, at least sporadically. Going back to, as best we can tell, 1950, when the U.S. Department of HEW, Health, Education, and Welfare, what we now know as the Department of Health and Human Services, awarded demonstration grants across the country to a number of states for protective service units. We truly don't know much about what happened to those grants and what followed from that, but we think that's probably where some states' APS programs began. That period is often viewed as the unofficial starting point for tracing the history of addressing elder abuse as a national policy issue and states attempting to respond to that. Congressional hearings about elder abuse date back to 1978. There's quite a record of hearings devoted to nursing home quality and abuse in nursing homes that actually goes back to some landmark hearings held by the Special Committee on Aging in the late 1950s and early 1960s. But otherwise, elder abuse began to get real attention in the late 1970s. Before that, though, earlier in 1970, Congress authorized, under Title 20 of the Social Security Act, authorized adult protective services at the state level. And as a result of Title 20 of the Social Security Act, states started creating their own adult protective service units or programs. Title 20 of the Social Security Act added that language to the act that we mostly know as the place where Social Security resides in the Social Security Disability Program. The Social Security Act, of course, is also home to the Medicare program, Title 18. It's home to the Medicaid program, Title 19, and of course now Title 20, which is, I'm going to come back to that a little bit later. Next slide, please. So a couple of, several key legislative milestones over the years. I mentioned Title 20 authorized states to develop protective services in the 1970s. In 1981, during the Reagan administration, Congress converted Title 20 to the Social Services Block Grant, SSBG, which has been, until recently, the only source of federal money that states could use to support adult protective services. Tennessee is one of about 37 states presently that choose to use some of their Title 20 dollars under SSBG to support APS. So that was authorized in 1981. In 1992, Congress reauthorized the Older Americans Act, and we created, and I'm proud to say this is one of my most, certainly I think I'm proud of this as much as I am almost anything else, creating the Elder Rights, Vulnerable Elder Rights title of the Older Americans Act in 1992 when the act was reauthorized. And what that did was bring together and strengthen, I believe, the long-term care ombudsman program in the Older Americans Act, a program near and dear to my heart. As Patty noted, I'm a former state long-term care ombudsman. We also included some language in the Older Americans Act that had existed about elder abuse prevention, all part of Title VII now. The comment I want to make about that is this. When we passed that in 1992, as with most legislation, Congress provides a specific amount of money that it authorizes that could be spent on that program, but then it leaves to the appropriations committees to provide that money. We authorized $5 million for the elder abuse prevention provisions for the nation. Sadly, in 2021, it remains just a hair over $5 million. So we're 1 year shy of the 30-year anniversary of those amendments, and the funding nationwide for elder abuse prevention through the Aging Network has barely moved a nickel, literally barely moved a nickel. We need to do more work with respect to that. So then sort of jump forward another decade to 2003 when the Elder Justice Act was first introduced. NAPSA was at the center of that, working with people like Bob Blancato, who formed with NAPSA and several other national organizations, the Elder Justice Coalition, with the purpose of trying to move and pass the Elder Justice Act. Bob Blancato remains to this day a good colleague of ours and a good friend of mine as the national coordinator for the Elder Justice Coalition. So we first introduced the act in 2003, but it did not become law until 2010, and I'll say a little bit more about that in a moment. And then jump forward more than a decade to 2021, from 2010, when the Elder Justice Act became law as part of the Affordable Care Act, to 2021, when Congress provided this year the first ever federal funding specifically dedicated to adult protective services. So coming out of the extraordinarily difficult, painful, awful year of 2020, one of the wonderful, wonderful outcomes for us, to be honest, has been this funding for adult protective services going directly to states. Next slide, please. Let me spend a little bit of time talking about the Elder Justice Act itself. When it was passed in 2010, that was after many years of trying. As I mentioned, it was first introduced in 2003. It was reintroduced in each of the subsequent 3 Congresses, so a total of 4 two-year Congresses, and never making it. But finally, in 2010, we had victory. We achieved it. We were excited. And we were able to pass the Elder Justice Act because there was this piece of legislation moving through called the Affordable Care Act. And that was moving towards completion. So from legislative language, we sort of hooked our wagon to that wagon train, and we were able to ride it to the end and become enacted into law as part of the Affordable Care Act. We were ecstatic over that. Our ecstasy was short-lived, however, because I think, as many of you know, the Affordable Care Act was, and for many remains today, controversial. And as part of that controversial nature of it, the Elder Justice Act was dragged down by the albatross that the Affordable Care Act meant for many. So that really hindered our future development of fulfilling the promises of the Elder Justice Act. There's a lot in the Elder Justice Act. I'm listing some of the provisions here. The reason I'm not going to go into any detail about those particular provisions is because they were never funded. They still are on the books, and we'll come back to that in a minute, but they were not funded. Now I'm going to move to the portions of the Older Americans Act that now are funded. Next slide, please. The Elder Justice Act, one of the parts of it that we believe is really important, and that got out of the gate almost right away. I don't remember if it got started in 2010, but it was soon after enactment. And that was the creation of the Federal Elder Justice Coordinating Council, the EJCC. And this is an entity made up of the secretaries or the heads of federal agencies or their designees, and it's co-chaired by the Secretary of Department of Health and Human Services, as well as the Attorney General, the U.S. Attorney General. But its membership includes individual agencies at HHS, like the Administration for Community Living, which actually does the actual coordination of the Elder Justice Coordinating Council. Different parts of the Department of Justice, Homeland Security, the Secret Service, the U.S. Postal Authorities, the Federal Trade Commission, quite frankly, any federal agency that has anything to do with elder abuse whatsoever. The National Institute of Aging or the National Institutes of Health are members of that. We think that's been really important, and they have continued to meet. And quite honestly, what it has accomplished is it's the first time through the EJCC that federal agencies actually talk to each other about their work in addressing elder abuse in one form or another. It's been wonderful to watch these aha moments as federal high-ranking officials go to their counterparts in another agency and go, whoa, I didn't know you did that. Maybe we should talk. And so one of the exciting things is that there are some states now thinking about creating their own versions of elder justice coordinating councils, something that we think is worthwhile. But for NAPSA, for the National Adult Protective Services Association, the heart of the Elder Justice Act was and is and remains the adult protective service provisions. There were three primary provisions. One was to create what we called a home for adult protective services in the federal government, and we've done that. That got out of the gate beginning really about 2014. It calls for the creation, and we have now, the Administration of Community Living's Office of Elder Justice and Adult Protective Services. Prior to the Elder Justice Act, not only was there not one single federal official of any kind who was dedicated full-time to adult protective services, there was not one federal employee dedicated to elder abuse itself. That's changed with the Elder Justice Act. The second part of the Elder Justice Act was to authorize demonstration grants to support and enhance adult protective services. And those, since about 2014, have been funded to some extent, and they've made great contributions at ACL with those funds. Most notably has been the funding and creation of the National Adult Maltreatment Reporting System, or NAMERS, as we refer to it. A small amount of money was given to each state to help them create their participation in the NAMERS program, the NAMERS system. Today, every state participates in the country on a voluntary basis. I think that is such a testimony to the willingness of states to step up here. Every state participates voluntarily, and we are gathering for the first time ever over these past several years, the first truly national data about elder and vulnerable adult abuse, about victims, and about adult protective services. And the data is just so important, and that was done as a result of the Elder Justice Act. And then, of course, ACL's been able to do some demonstration grants to enhance APS. I believe there's an RFP out from ACL currently to help APS programs deal with the opioid crisis and its impact on caseloads and on clients. But the heart of the Elder Justice Act is its formula grant program for adult protective services. This was to provide direct funding to states to support their adult protective service programs. That was what mattered most to us at NAPSA. To get money, there has never been dedicated funding federal for adult protective services, and we needed that. States needed that badly. It was far and away the biggest part of the Elder Justice Act in terms of authorizations, at $100 million to go to states. I might just mention parenthetically that in the first version of the Elder Justice Act that was drafted, that was $300 million in 2002 in the early draft, but ended up for a variety of reasons at 100 million. But we thought 300 million was a conservative figure then, so we've got our eyes on a bigger prize looking down the road. Next slide, please. So from 2010, when the Elder Justice Act was passed as part of the Affordable Care Act, until 2021, there was not a nickel of funding that was provided under the authorization to provide funding directly to states. We came close, but as the old saying goes, close but no cigar. Next slide. The top part of this graph here shows you the elder justice funding for what was called sort of the Elder Justice Initiative that finally began to flow from Congress to the Administration for Community Living. And that was the money that I talked about earlier for development of the NAMERS system, the National Adult Maltreatment Reporting System, the demonstration grants, the creating of an ACL Office of Elder Justice and Adult Protective Services. From 2010 to 2014, not a penny. And then in 2015, finally, $4 million, then $8 million, then $10 million, then $12 million. And now in FY21, the current fiscal year, ACL gets $14 million to support their Office of Elder Justice and Adult Protective Services, to fund those demonstration grants, to support the NAMER system, to provide technical assistance to states. But at no point was that money enough to provide funding under a formula grant to states. So the states struck out year after year after year. In 2020, Kendra and I, with the support of NAPSA, the NAPSA's Public Policy Committee, APS administrators like Renee and staff across this country really did their best to try to convince policymakers, members of Congress, that as they consider the various COVID response packages, like the CARES Act, for example, 3 total packages that passed Congress in 2020 for COVID response or COVID recovery, we came close, but we could not get funding for adult protective services or for the Elder Justice Act as part of that. One of the reasons is because Congress was trying to find vehicles to put money out for COVID recovery. So they were tying money to existing programs that already had appropriations, like the Older Americans Act, for example. But because we did not have a funding stream under the Elder Justice Act, it was complicated and Congress didn't give us the funding. But all that changed at the end of 2020 with the passage of the Coronavirus Emergency Supplemental Appropriations Act in late December 2020, and then signed into law in the very beginning of 2021. This legislation, as part of this comprehensive coronavirus response package, provided $100 million for the Elder Justice Act. And it said in the language explicitly, of that amount, no less than 50 million must go directly to states for adult protective services, which meant that more could go if the federal government agreed with that. They provided 100 million, no less than 50 million to APS. So for us, it was really important to get that figure higher. And then jumping ahead just a little bit, and I'll get into more detail, that legislation was followed several months later in March, as I think probably most of you know, when Congress passed the American Rescue Plan. The American Rescue Plan provides $276 million for the Elder Justice Act. So virtually overnight, we went from zero, nothing, to actually having real dollars flowing out to states. Next slide, please. Under the Coronavirus Response and Relief Supplemental Appropriations Act of 2021, as I said, no less than 50 million of the 100 million must go to states APS. The Administration for Community Living in February, through the Federal Register, put out a notice that in fact that they were dedicating almost 94 million of that 100 million under a formula to go to states. That gave states their first ever funding for adult protective services. Now, the funding had to be tied to COVID, to the pandemic. States had to develop a plan, and every state did, showing how they would spend that money for adult protective services related to the COVID pandemic. And you can see that some of the uses for which that money could be put are listed here: training, PPE, technology, whatever it might be. It was just an incredible development. And I think Tennessee realized $1.8 million in new money as part of that package. Next slide, please. So now comes the American Rescue Plan, providing $276 million. Of that amount, 88 million more was dedicated to states under the formula for APS. So that added 88 million to the $94 million already provided. And that money has just been announced, I think, in the last couple of weeks. And so states have a new bolus of money coming in to add to their money. The really good news, I think, is that it's not tied directly to COVID, because it was not a COVID recovery package. And so states have a lot more freedom. So, for example, under the Coronavirus Relief Act from earlier this year, states may have been reluctant to hire employees because they didn't know that they would have any more money, and if they couldn't directly link it to COVID. This has given them much more flexibility. But from our standpoint, the really fabulous news out of the American Rescue Plan is that they also provided funding for FY22 to the tune of matching what they provided in FY21. Remember, in December, they provided 100 million. They added 88 million in the American Rescue Plan for a total of 188 million. And the American Rescue Plan says states will get the Elder Justice Act will get $188 million in FY22. And of that amount, at least 100 million must be sent out to states' adult protective service programs. So that's huge. It's huge for two reasons, in particular, three reasons. One, because it's really needed money to combat elder abuse. Two, it gives states the knowledge that the comfort that they've got another year of funding coming to them. And three, it means that we don't have to spend fretting over getting funding for the new fiscal year that begins officially October 1 of this year. We can focus our attention more on FY23 to try to begin to get sustained funding for adult protective services. I just want to make 2 points because I know my time is running short. These funds are to be used to serve, and it's crystal clear, and ACL's made it clear, clients regardless of age that are served by adult protective services. It's not just older clients, it's vulnerable adults over the age of 18 if they fall within an APS program. And we also have really important language that we wrote back in 2003, which is that these monies must supplement, not supplant, any other federal, state, or local dollars that go to adult protective services. So it's above and beyond what's currently there. Next slide, please. I'm not going to elaborate here very much, but I want to say a few words about the Social Services Block Grant. My imagery is having dealt with SSBG for many years, it's sort of, to me, a picture of Hades. Dante's Inferno sort of reflected the world of SSBG to me in terms of policy. The second slide is, you'd have to really look closely, but that happens to be a tree frog on a West Virginia tree, well camouflaged. And to me, that's a metaphor for SSBG because so few people, except those in adult protective services or who run SSBG programs, couldn't tell you what it is. They don't know about it, except that they should know it's the single largest pot of human service money that the Congress provides to states. Next slide, please. I'm going to skip this one and go to the next slide very quickly here. In Tennessee, Tennessee uses total Tennessee SSBG dollars, according to the latest report that I've seen from the federal government, is almost $34.5 million total. And of that, the 13 million, about a third of it goes for Tennessee's vulnerable and elderly adults. And of that amount, about 50% goes for adult protective services. So as I said earlier, you're one of approximately 37 states that choose, it's completely a state option, choose to use some SSBG funding for adult protective services. The reason why I want to stress this is this. SSBG is often under attack. It's been zeroed out in some presidents' budgets. We've had chairmen of the budget committees in the House call for eliminating, zeroing out SSBG. So we've come close to losing SSBG several times. And you can see the importance of it while we celebrate, and I do mean that, we celebrate this $1.8 million for Tennessee from the Elder Justice Act. That's fabulous, and we want to continue it. It represents just 22%, if my calculations are correct, of Tennessee's total APS program based on its SSBG and Elder Justice Act funding. In other words, the Elder Justice Act is not replacing the importance of SSBG, at least in 37 states. And so from a NAPSA perspective, we continue to need to be ever vigilant about protecting SSBG. because it remains far and away the biggest source of federal funds that are used for adult protective services, even though they're not dedicated to that. Next slide, please. So looking ahead from our standpoint at NAPSA, we can't have this new $188 million in FY21 and FY22 for elder justice and adult protective services be a one-off pot of money. As good as it is, it needs to become part of the annual federal appropriations, just like we have annual appropriations for child protective services, for domestic violence, to other forms of family violence. We need to sustain and grow this funding. We also need to protect and expand other critical funding to combat elder and vulnerable adult abuse, the social services block grants, as I just discussed, as well as VOCA, or the Victims of Crime Act funding, that some adult protective service programs have been able to tap into. And the big issue in front of us, besides funding at the moment, is to reauthorize the Elder Justice Act, because it is, in the words of legislative parlance, the legislation has expired. We need to reauthorize it and change it, streamline it, but continue to have adult protective services at its core. Next slide. I would conclude simply, I'm not going to dwell on this. This is an old slide. The amounts of money have changed, especially with the addition of the Elder Justice Act funding. But I do not believe the slices of pie have changed at all, even in light of new monies that we've received, because so did domestic violence, so did child abuse. And no one in the world of elder abuse, of adult protective services, would argue that there's adequate funding nationwide for child abuse or for domestic violence. But we need to grow the pie so that adult protective services has a larger, at least, amount of money, and maybe a larger share of the pie, given the fact of the demographics of our society and the fact that the combined total of child abuse reports and domestic violence reports, the combined total is exceeded by the number of reports going to adult protective services. So I don't believe the slices represented here, 2% of the total federal dollars spent on abuse and neglect, go to elder abuse. We need to change that. Next and final slide, I think. I'll just simply say the work that you're doing, your coalitions are doing, your counterparts in all states, your voices are probably needed now more than ever to sustain the success that we got this year in 2021 into 2023 and beyond. We need to continue, as Dr. Harris said at the beginning, we need to educate, build relationships. We need coalitions across the lifespan. I believe we're in this together with other forms of abuse and violence, regardless of age or category. And I think we need to have common cause with all those other actors. And I think all of us at every level need to speak loudly and often about why this is such an important issue, why it needs to be part of the national agenda, why that we need to support states as they do the extraordinary job they try to do and have done, particularly during the pandemic, under very difficult circumstances, to respond to reports that you receive, will continue to receive, and you'll receive more of them in the future, of abuse, neglect, and exploitation of older adults and vulnerable adults over the age of 18. I think I have a closing slide, and I'm done, and if there's time, I can respond to some questions. I'm in that
Hey,
picture.
Bill, this is Patty.
Hello,
You are
Patty.
in that picture. Where are you in that picture? Can you go back to that?
I've got my head, if you, on the left-hand side of the chairman, Senator Brock Adams,
Okay.
I'm looking at some paper, probably responding to a question he's asked of me that he can ask one of the witnesses at our hearing.
That's great. Great. Thank you for sharing that. Great. Thank you for sharing this information.
That was before color. No, just kidding.
I doubt that. We are out of time, so maybe we can welcome you back next year so that we have more time to spend with you, more time to ask questions. We have recorded this presentation, so thank you for agreeing with that, Bill. So we'll be able to send that out to you. It is quite a momentous time for Adult Protective Services, as Bill shared. Really want to thank you for sharing the information, because it helped me, and hopefully all of you, understand where we are currently by connecting the historical pieces. There was so much information, Bill, that you provided that helped me understand how we got here, because it wasn't so linear, right? It was an up and down and back and forth. Appreciate the energy that you shared to help us all move forward collectively and collaboratively. And most importantly, thank you for your work, your passion, and your effort to improve the lives of all older and vulnerable adults across this country, but most especially here in Tennessee. So thank you for sharing your time with us today, taking your time, providing information.
Just a quick question, Bill, which won't take you more than 15 minutes to answer. If you could please send us the information about the conference you mentioned at the beginning of November. I certainly will attend, and I certainly will bring a team from our CARES organization and from the university. So if we could get the information, I would appreciate it.
Absolutely. We'd be so thrilled to have you. Thank you all so much for putting up with me. I know I went on a little long, so thank you.
No, we learned
You
a
did
lot.
not.
Thank you.
Oh, this information has been great. Appreciate your time. Look forward to having you back and seeing you in person. Hopefully, many of us or some of us can attend the NAPSA conference in San Diego in November as well. We'll make sure people have that information.
I might
Thank
say
you
that
so much.
we're grateful to the Administration for Community Living for making it clear that, you know, part of these Elder Justice Act funds can be used to attend the conference, which we're just thrilled about.
Yeah.
Oh,
Right,
good.
that
Then the
is
state will send us. Thank you, Joyce.
Sorry, Joyce.
Please make arrangements for me, Dr. Robinson, and maybe 7 or 9 more people.
Thanks, Bill. Appreciate it so much. Everyone have a great day. Enjoy the rest of the week.